Good day, students. I'll be your biology teacher for today, and the topic for today's lesson is reproductive health. By the end of the lesson, you will be able to name and discuss types of harmful traditional incision, female genital mutilation, FGM, explain how reproductive organs can be cared for, state the importance of prenatal care, list causes of infant mortality, give the full meaning of STIs, HIV, and AIDS, state the causes, symptoms, and prevention of STIs, HIV, and AIDS, explain how STIs, HIV, and AIDS can be transmitted to fetus and infant. Reproductive health. Female genital mutilation, FGM, also known as female circumcision or cutting, is a traditional non-medical practice of altering or injuring the female reproductive organs, often by removing all or parts of the external genitalia. External genitals includes the clitoris, labia, mons pubis, and the urethral and vaginal openings. The traditional custom of ritual cutting and alteration of the genitalia of the female infants, girls, and adolescents persists primarily in Africa and among certain communities in the Middle East and Asia. On average, girls are subjected to FGM between birth and age 15. Types of FGM: 1. Clitoridectomy. 2. Excision. 3. Infibulation or pharaonic circumcision. 4. Introcision. 5. Unclassified types of FGM. 1. Clitoridectomy. This involves the removal of the prepuce and the tip of the clitoris. This is the only operation which medically can be likened to male circumcision. 2. Excision. This involves the removal of the clitoris and often also of the labia minora. It is the most common operation and is practiced throughout Africa, Asia, the Middle East, and the Arabian Peninsula. 3. Infibulation or pharaonic circumcision. This is the most severe operation, involving excision plus the removal of the labia majora and the sealing of the two sides through stitching or natural fusion of scar tissue. What is left is a very smooth surface and a small opening to permit urination and the passing of menstrual blood. This artificial opening is sometimes not larger than the head of a match. 4. Introcision. In this form of mutilation, when a girl reaches puberty, the whole tribe, both sexes, assembles. The operator, an elderly man, enlarges the vaginal orifice by tearing it downwards with 3 fingers bound with opossum string. In other districts, the perineum is split with a stone knife. 5. Unclassified types of FGM. This includes pricking, piercing, or incision of clitoris or labia, stretching of clitoris and or labia, cauterization by burning of clitoris and surrounding tissues, scraping of the vaginal, introduction of corrosive substances into the vagina to cause bleeding, or herbs into the vagina with the aim of tightening or narrowing the vagina, and other procedures which fall under the definition of FGM given above. We'll be back after the short break.